Hello, my name is Ryan Bourne and I occupy the R. Evan Scharf Chair for the Public Understanding of Economics at the Cato Institute. Welcome to this Vincent Centre explainer on the value of a statistical life, an economic concept that has attracted attention recently during debates around COVID-19 lockdown measures, and which I write about in my forthcoming book, Economics in One Virus. On March the 20th, 2020, New York Governor Andrew Cuomo gave a press conference about his state's lockdown. Questioned by reporters on the balance of costs and benefits of the measures, Cuomo responded in a way that would rankle with economists. "I want to be able to say to the people of New York, I did everything we could do," he said. "And if everything we do saves just one life, I'll be happy." Later on, he was more explicit. "Human lives are priceless, period," he said. Now, Cuomo was empathizing with voters facing the loss of loved family members from COVID-19. But deep down, he will surely acknowledge that it is quite silly to imply that public policy can place an infinite value on every life when considering government regulations. Despite people expressing disgust at we economists for pointing out this hard truth, none of us, in fact, live our lives in ways suggesting we consider them infinitely valuable. In most ordinary day-to-day situations, in fact, we just freely decide on the balance of risks we are willing to take, putting implicit values on avoiding death. We drive on motorways, for example, knowing the mortality risks of crashing. We make judgments on whether to drive that route at that time anyway, given the benefits of getting to our destination and weighing them against the broader costs of driving, including, of course, the risk of dying. Of course, sometimes we change our mind if the risks change, if it's snowy or roads are icy, for example. But what about situations where governments are imposing safety regulations? In working out the costs and benefits of government policies that mitigate mortality risks, how should governments value the deaths avoided from the risk mitigation? Here, economists since Nobel Prize winner Thomas Schelling have believed that observing groups' own behavior within markets can really be informative in providing governments with reasonable proxies about the value they should place on avoiding specific death risks. Every day, people make decisions that reflect how much they value avoiding mortality. Individuals in hazardous jobs, such as mining or high-rise building projects, are often paid a compensating differential, a higher wage to compensate them for the additional risks of death they face. Now, economists like Schelling say that we should utilize this labor market information to estimate how much groups in general are willing to pay to avoid given fatality risks. Or another way of thinking about it is how much they'd be willing to accept to bear those risks. Measures of this trade-off between money and risk allow us to then calculate a value of a statistical life. That is, how much a given group of workers would have to be paid to compensate them for the statistical probability of one of their group dying from that risk. Suppose, for example, a group of US manufacturing workers, on average, accepted being paid $2,000 extra per person to compensate them for an uplift in the risk of dying at work of 0.02%, quite a small uplift in the risk of death. Dividing how much each worker would need to be paid to avoid the risk by the increase in the risk itself gives us a value of how much the group would accept to avoid the statistical probability of any one death. In this worked example, that would be $2,000 divided by 0.2%, which gives a value of a statistical life of $10 million. Now, it's really important to think about what this means, because this decision, this balance of how much somebody is willing to accept and the uplift in the risk of death is a decision taken at the margin. A worker has to be compensated for a small increase in the risk of dying by a specific amount. It doesn't follow, of course, that a worker would accept a 100% likelihood of death for $10 million. In other words, the value of a statistical life is not the value of a human life, but the collective value we place on avoiding the likelihood of one death for a given risk. Think about the value of a statistical life this way. By averaging the perceived value of risk mitigation across a group, we can create this statistic which tells us how much that group of people would be willing to pay to avoid one person in their group dying in all statistical probability. Another way of thinking about it is how much they would need to be paid to accept the statistical probability of one death. Now, in the absence of this type of data for all individuals and all risks, such as the risks inherent in COVID-19, these calculations from labour markets, these market-based measures, can therefore be used as reasonable proxies by governments to represent the societal value of mitigating risks in public policy decisions. They can therefore give us values of the benefits of safety regulations, which we can insert into cost-benefit analysis when we examine government regulations. So how does this relate to COVID-19? Well, American economist William Fuscusi has estimated that the actual value of a statistical life for small risks in the UK is around £6 million. Now, COVID-19 lockdown regulations help mitigate mortality risks by reducing human contact. Some economists have therefore sought to estimate the monetary value of these health benefits, these reductions in mortality risks, by multiplying the value of a statistical life from labour market studies by the number of deaths believed to be avoided via government lockdowns. So if the first UK national lockdown avoided 10,000 deaths, for example, this 6 million figure would imply health benefits from those first lockdowns equating to a value of around £60 billion. That's around 2.8% of 2019 GDP. In analysis then, when we're thinking about the costs and benefits of lockdowns, we need to compare these calculations of the value of health benefits of lockdowns to their economic costs. And in this example, if the economic costs of a given lockdown were less than £60 billion, then those lockdowns would have passed a simple cost-benefit test. Now, in reality, these seem like quite extraordinary numbers. So are they reasonable? Well, of course, there's been much debate around the epidemiological estimates of how many lives are actually saved by lockdowns, or whether those lockdowns, especially early on, merely delayed deaths rather than mitigating death risks. Yet there are perhaps other reasons to doubt the use of old labour market estimates of the value of a statistical life as applied to COVID-19. For starters, the risk of death from COVID-19 are much, much higher for specific demographic groups such as the elderly than anything seen in labour market studies. And of course, elderly people tend not to be part of those labour market studies, making it much more difficult to ascertain how much they'd be willing to pay to mitigate these much higher death risks. Evidence does suggest that older people have a lesser willingness to pay to avoid death risks than middle-aged people. And there might also be reason to expect more variation in their preferences than one might find among a group of workers with quite similar backgrounds. Of course, the lockdown regulations, if sustained, also hurt our incomes, which is likely to lower the amount we'd be willing to pay to avoid the death risks then from COVID-19. So thinking about all these things together, there are actually good reasons to think that using existing estimates of the value of a statistical life may overstate the benefits of lockdowns when applied to COVID-19. Now, what are we to make of all this? Well, evidence does suggest that people value reductions of mortality risks highly in their own lives, and these observations can be helpful in weighing up the benefits of government regulations such as lockdowns, the whole point of which is to reduce death risks. But when applying that insight to COVID-19 in particular, we have to be extremely careful. We're dealing with risks and preferences here that may look very different to the sorts of things we see in labour markets. And of course, and finally, even if lockdowns do pass a cost benefit test, that doesn't necessarily mean that they're the most cost effective way of mitigating any given risk. It might be that there are other measures we can take which have much more favourable ratios of benefits to costs. If you found this explainer interesting, then you can find much more on the value of a statistical life, and indeed much more on the economics of COVID-19 generally, in my forthcoming book, Economics in One Virus, which is now available from the Amazon UK bookstore for pre-order. Thank you so much for listening.